Last day. It is officially the last day. Here come the tears.
My name is Autumn Rasmussen. I'm 21 years old and I'm from here, sunny St. George, Utah.
My name is Amanda Roberts. I am a runner, I'm a mom, I'm a wife.
I started to run after I had my second baby. She was colicky, and I would put him in my double stroller, and we would just run.
My name is actually Stephen Douglas Adams, but I go by Doug Adams. Often I'm called D3.
Typical weekend ride, heading from St. George out to beautiful Ivins.
My diagnosis was breast cancer, ductal carcinoma.
It was actually stage 4 metastasized prostate cancer. When I was diagnosed, they gave me 18 months to 24 to live, which was a little bit of a shocker.
It was officially cancer and Ewing sarcoma. It just kind of hits you like, wait, I have cancer?
Mine was in a milk duct. From there, it can go into lymph nodes. Lymph nodes are throughout your body.
It started in the prostate. It was in my pelvic, my pubic bone. It was in my neck, multiple spots in my back, in the back of my stomach.
You see someone that gets a cancer diagnosis, and can you imagine what that feels like to them? It's my world is ending, or it's changing dramatically.
But it's also devastating to a family, and trying to maneuver the ins and outs. It can be so complicated.
It was humbling going through cancer with 6 kids. I had my kids actually have to encourage me to get up out of bed sometimes.
Cancer diagnosis in itself just knocks you back. But then the logistics of it and all of the testing and emotional and finance and every piece is very burdensome.
So right now I'm getting a medicine called Mesna as part of the day. I get it 3 times a day when I come for chemo, but it's a drug that helps protect my kidneys and my bladder to make sure my insides are working properly still with all the chemotherapy drugs I get, so.
Sorry.
It's okay.
As sometimes you feel like a failure. You're not supposed to be the patient. You're supposed to be the mom.
They come up and they see the blankets and they see the port pillows for where you access the chemo, and the emotions that they feel right as they're starting this super scary journey of, am I gonna make it? What's this gonna do to me? Am I gonna lose my hair? Am I gonna just be sicker than a dog?
1, 2, 3, big poke.
Being able to come to a place where their care can be managed and we can take some of that burden off of them, I think is really huge.
I remember very much in the beginning, in the most stressful days, we had this whole medical team surrounding us, allowing us to be able to accept what the diagnosis was and then move forward without worrying about the logistics of it.
We did several rounds of chemo. I was a very nice looking bald-headed person. So after that, it was still around. We did radiation the following year, which wasn't too bad. And we tried several different immunotherapies.
There was times in my treatment when I got really sick, and I would go out and I would run, and I would question if I would be able to do it.
At the beginning, hated the cancer clinic because it was the mentality of, I have to go there. I have to receive these medications that make me feel crummy and awful and lose my hair. And going there with the sights, the sounds, the smells was really hard. Last day. But then the more I went, the more I realized what an incredible blessing it is to have it 10, 15 minutes from my house.
Our oncology program here at Intermountain Health, specifically here at St. George Regional Hospital, is here to partner with the community in making sure that we get the latest and greatest in cancer care here. We really have this commitment to make sure that anything that can be done with cancer can be done here locally.
Dr. Rhodes, my oncologist here, mentioned this new Pluvicto. My wife's eyes, like, oh, we know about that. No way. 1, we were waiting for it to come to the US, and 2, we have it at Intermountain.
We understand the strain it is on families to have to travel for cancer care. And so being able to not only guarantee the expertise that you need to get cancer care here, but also make it as convenient as possible is really within our mission.
You did this to me.
So after we did the Pluvicto and we looked at that scan, there was one, I get a little emotional, there was one spot left. And my wife and I just looked at it like, you know, it's amazing. It's a lifesaver, it's a game changer to see all those years of all these different types of medications, and to look at the scan, you know, from the first scan to the second scan and see one spot where there used to be numerous. Like I said, it's a game changer and it's a blessing.
Healthcare is a calling, and if you're here to punch a clock, you're in the wrong business. If you're here to really help and build and uplift, that's what we look for. And we are very intentional on a culture here of caring, compassion, and skilled clinically.
Ring this bell 3 times well. It's told to clearly say, my treatment is done, this course is run, and I am on my way.
We are fully supported with a staff who loves the patients. She walked in here meeting 16 nurses. She's leaving with 16 friends who truly do care about her life.
My nurses, they were my angels.
There's a really tough, awesome nurse there at the cancer center. And she came over and she just hugged me. And she just said, it's okay. She said, this is really hard. She said, you are strong. You can do this. This is worth it. This is worth it. You are worth it.
8 years ago, they said basically at 52, my life would be over in the next 18 to 24 months. Now it's been 8 years. We're thriving in St. George. You know, God bless Intermountain.
We think it's important that this community has confidence that they are getting the standard, the latest, the greatest, at the cutting edge of cancer treatment here. We don't want to hold anything back.
I'm just so grateful for the opportunity that I've had to get my cancer treatments at Intermountain Healthcare. We are about 3 weeks post-chemo. They have been so wonderful, and the staff has been so amazing.
This is where we live. This is where we breathe. This is where we get our treatments. This is Intermountain supported St. George, Utah. Amazing place, amazing people. Wouldn't want to be anywhere else.